Harihi Om. Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Gurave Namaha. Namaskaram, Masters. Monanandamayam Devam Nirmala Spatikakrutam Andharam Sarva Vidyanam Hayagriva Upasmahe Hayagriva 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 Idiopadet Tasya Nishtara Indukanya Prabhavatu Om Shanti Shanti Shanti. My salutations at the lotus feet of Dr. Hahnemann, Master E.K., and other legendaries of homeopathy, and my pranams to all the participants of these classes. I'm very happy that about 100 people joined before 7:30. I request you all to be present 5 minutes before the class so that miss any points. And you can relax for 2 or 3 minutes and then notes starts immediately. This punctuality is one of the things we have learned from our master. I expect the same from you all. The most interest, whatever interest you are showing, my class depends upon your enthusiasm. If you are sincerely following the class, I will be very glad to give more classes. Coming to the subject, we have learned in the beginning what is sickness, and now, last few classes, we have learned what is cure also. How do we know whether the cure is in right order or not? Today, we will discuss those points. Cure according to allopathy and according to homeopathy, they differ. According to allopathy, actually, it is not a curative science. It is a science of the disease. They analyze the disease and they tell only the symptoms of the disease. Whereas in homeopathy, it is called science of cure. We always aim to get 100% cure to the person or the patient. So whether our treatment is going in right direction or not, whether the patient is getting cured according to the law given by Dr. Herring. This is called Herring's thumb rule, thumb law. According to that, whether cure is there or not, today I will explain you. This will help you to know, suppose you are taking homeopathy, you will come to know whether it is in right direction or not. Then you can conclude that the homeopathy is working or the drug selected is in the right direction and the medicine is selected. That is the important point. You have to know that. Okay. Now coming to the today's notes. The proceed from the cure must proceed from number 1, center to circumference. The cure must proceed from center to circumference. Number 2, above downwards. Number 3, within outwards. Number 4, from more important organ to less important organ. And number 5, from head to hands and feet. I will explain you what is this. When a patient comes to us, we give the medicine based on the totality of symptoms. That is, taking all the symptoms into consideration, we will select a similar remedy. I told you similia, similibus curenta, like you. That means the drug which has given out same set of symptoms. If a person is having similar symptoms, when we give medicine, the patient will be cured permanently. The cure, the medicines are proved on healthy human beings. These things I will be repeating several times, only for one reason, that even in dream somebody wakes you up. You must define what is homeopathy. You must be able to understand it well. That is the reason some points I will be repeating very often. Don't think that it is waste. No, it is not waste. It is only to make you understand it better. So the cure, whether it is in right direction or not, is called Herring's thumb rule. Thumb rule. What is Herring's rule? Number one, center to circumference. Our body is also a government, I told you. This has a center, this has important organs, this has unimportant organs, and there is circumference, that is skin, hair, and nails. The center is the one called central nervous system, CNS, that which is making us move, that which is animating this physical body. The vital body is when animating the physical body. The sickness first starts there. I told you, understanding is affected. If somebody is not able to understand, means he is sick. When a medicine, proper medicine is selected, his understanding levels will, his will and understanding levels will improve. Thereby, he will be able to comprehend it properly. And he will be able to present properly. This must be the first step of cure. That means the center should be repaired first, and then the circumference be the last. A person comes with mind symptoms and also skin symptoms. The first symptom to be cured is a mind symptom. Last symptom to be cured is a skin problem. That is called center to circumference. When the right medicine is given, patient will come and tell, "Sir, I am okay. I feel happy." Skin still problem is there. Many times it's my experience in the clinic that patient comes and says, "Sir, don't worry about my skin. I am all right." Why should I worry about his skin problem? But patient gets such a thought that most important is the center. If the central government is strong, all the country will be normal. If the central government is weak, everything will go weak. So everything comes from center to circumference. The disease also comes from center to circumference. The cure must be from center to circumference. That means center becomes all right, then slowly circumference will also be cured. This is the first rule. Next, above downwards. When a medicine is given, suppose, example I will give you. A person comes with headache and also pain in the legs. The first symptom to be cured is the headache, because from head to hands and feet. It should not go in reverse direction. If the cure is not in right direction, two things we have to understand. Number one, the patient has not followed the right restrictions that are given. That is the first one. And the second rule is the medicine selected by us is not correct. In these two situations, the cure will not be in this order. Suppose the cure is in this order, that means headache is there and also leg pains are there. He says that headache is better, but leg pains are still there, hand pains are still there. No problem. This is in right direction. That means the medicine selected by us is correct. This also the physician must observe. When a patient comes to us as a follow-up visit, we should understand that the patient is getting cured in a right direction or not. If it is not right direction, we have to study the case again. We have to take up the symptoms again and study and select a right remedy. So, first rule is center to circumference. Second rule is above downwards. Third one is within outwards. What is center and what is within? That means in a particular place or organ, first the within, inside must be cured, then outside. From within outwards. The cure travels from within outwards. Center to circumference is the total center to circumference. In a particular organ, within the organ, then outwards of the organ. That is the right direction of the cure. Next, from more important organ to less important organ. This is also very important. Homeopathy is the only system which takes care of the total human being as one entity. Patient has suppose heart problem. We are the cardiologists. Suppose the patient has some other problem, like orthopedic problem. We are the orthopedicians. Patient has some stomach problem. We are the stomach doctors. Totally, it has to be cured as one single entity or one single person. That is very, very important. In this case, there are organs which are more important. There are organs which are less important. Heart, kidneys, brain, liver, lungs. These are all very important organs. A problem is there in the kidneys and also a problem is there on the leg pain, something like that. Legs or extremities are the unimportant organs. They are not that important. As important as the heart, liver, etc. First, heart must be all right. Then comes the outer layer or less important organ. That is the reason homeopathy has no specialities. Unfortunately, we find boards outside homeopathy boards that we are specialists in thyroid, we are specialists in asthma, like that. There is no specialization in homeopathy in the name of the organ. We are specialists of the human beings. As a whole, the person, we are specialists of the person. The person is taken as one unit. That is the reason homeopathy, if they start taking medicine, all the symptoms are taken care of by a single doctor, homeopathy doctor. When we were very young, those days, there was family doctor concept. We had one family doctor when I was 8 years old. He's not MBBS doctor, he's only LIM. Those days in Madras, there was 1 year course. He finished that course and he became a doctor. For him, everything he can cure or he can attend. Let it be heart problem, let it be a delivery problem also. He will attend. Gynecologist. He is everything. And he used to have a microscope. He used to maintain his own clinic, diagnostic clinic also. Very important concept of family doctor concept is there. Entire our family, whoever comes, he knows. He knows the constitution of the persons. He knows all the symptoms of the person. Whenever we go for some acute problems, he knows. So this was the concept earlier. Now specialization has come. Specialization also too much specialization. Hands doctor, then fingers doctor, nail doctor, right side hand, left side hand. Doctors are different. So one problem comes, we have to go to the doctor. Again, another problem comes, we have to go to this doctor. We have to run from pillar to post. That is the other system. Whereas our system, one doctor will ask all the questions. From head to toe, he will take up all the symptoms. From mind, he will ask everything. Why? Because this is the only science which can cure comprehensively, which can look to the patient in a total comprehensive way, a bird's eye view. And he gives a treatment, thereby the person is totally cured. So whenever the problem comes here, from more important organ to less important organ, that means more important organs are very, very important. Less important organ, no problem. Patient can wait and patient will not die. Suppose the brain is involved, some stroke comes or heart is involved, patient may not live also. So what homeopathy says is, first take care of the important organs. Automatically, the medicine what we give, we need not take care. When you select a medicine based on totality of symptoms, the cure is in this direction. Patient comes and says, sir, my chest pain is reduced. However, my stomach pain is still there, or my leg pain is still there. Then we have to say, wait, please wait. It will be cured because the cure is in a right direction. You will be all right. Just wait. You will be okay. Like that, we have to tell the patient. So, and fifth point is head to hands and feet. A person is having headache and also hands pain. Then he has to be cured first with the headache. The other time I said from above downwards. One example I will give. A person comes with a leg hand pain. Hand pain, upper portion pain is there, shoulder pain is there, and also lower portion is there. The cure must be from above downwards. The first, this pain should be reduced, then down person, then fingers, above downwards. So how much meticulously the science is drawn. Just see, thanks to Dr. Hahnemann, we are indebted to him for lifestyle. Because such a science he could discover. Whereas a person nowadays with the complication of so many diseases, so many problems, so many symptoms, a day will come where we have to stop taking food and take only tablets. That day is not far. Already we have achieved it. But in homeopathy, whatever may be the number of symptoms, whatever may be the number of organs involved, whatever may be the changes in tissues, one medicine will cure totally and completely, and the direction of the cure must be 5 points. He must say, the patient must continue to say that following these 5 principles, he must say that, sir, my head is better, sir, but hands are still pain is there. We are in the right direction. Wait, it will be cured. We have to ask the patient to patiently wait. As long as the inner organs are safe, as long as the important organs are safe, patient is not going to die. And the vital force is working to cure it. It is happening. Maybe it may take some more time. You can't just do it as a miracle. It is not possible. There are no mantrams. It is a science. It works according to science only. And the provings, wherever you see the provings, anywhere any person takes these drugs, provings are same. Anywhere any person takes for the bryonia symptoms, bryonia will work irrespective of the area, place, gender, any nation or anything. There is no discrimination. It is a human being suffering, give the medicine, is cured. And this applies to animals and birds also. This applies to even plants also. We call it as veterinary homeopathy, whether it is agro-homeopathy or human homeopathy, the rule is same. Why? Because we are giving medicine to the vital force. We are giving medicine to the central nervous system, and which is there governing the entire body. Remember this point. Entire body is governed by central system. If the center is all right, everything will be okay. That is why always we have to select a strong center. We must give sufficient majority to the center. Then they will be able to do good, something good to the people. If the center is weak, every day there will be returning same fashion. Here also center must be very strong, and if right medicine is given, is cured. Next point. The symptoms should disappear. The symptoms should disappear in reverse order. The symptoms should disappear in reverse order of their appearance, which is called reverse saucer method. SAUCER. Reverse saucer method. And such symptoms are cured permanently subject to the condition patient has good food habits and proper lifestyle. Proper lifestyle. The symptoms should disappear in the reverse order of their appearance, which is called the reverse saucer method. And such symptoms are cured permanently, subject to the condition that the patient has good food habits and also patient maintains proper life order. This is a must. Every homeopathy doctor should know what is order and what is disorder, what is good and what is bad, what is good for the body, what is good for the mind, what is good for the individual. A homeopathy doctor should know for himself. Suppose homeopathy doctor smokes and he advises others not to smoke, it will not work out. Homeopathy doctor takes coffee and asks others not to take coffee, it will not work. First, we have to follow what we preach. Every word you follow and experience the truth and then tell others, it will have very good impact. Okay? As opposed to next point. Okay. Next point. If this is not happening in this order, the physician should understand that the medicine prescribed is not the correct one. If this is not happening in this order, the physician should understand that the medicine prescribed is not correct. This is the important point to be understood by the doctor. He must know what is correct and he must know what is wrong. Both he must be able to judge properly and give the right medicine. Suppose he has come to know that it is wrong. That means a person's skin complaint is cured, but his internal symptoms aggravated. That means medicine prescribed is wrong. What we have to do? We have to study the case again, again and again. Then we have to prescribe the medicine. Anytime, any number of times, we have to study again and again till we find the right remedy. Why we are unable to find the right remedy? There are three reasons. Number one reason, patient has not given case properly. He has not given all the symptoms out. Number two, the doctor is not having sufficient knowledge of homeopathy. The doctor fails to select a right remedy because he does not have full knowledge of materia medica. He may fail. Many times we fail because the patient has not given right picture and the physician also has no idea of what is correct medicine. Then it may not work properly, and in such cases we have to go for re-study of the case. Entire case you have to study again. Take down the symptoms. Repertorize. What is repertorization? I will explain later. Then you find out the right remedy. Then the direction will be in right way. So here clearly Kent is telling this is not happening in this order. Cure is not happening in this order. Then the physician should understand that not the right remedy. Next point. All chronic diseases. All chronic diseases have their first manifestations. All chronic diseases have their first manifestations upon the person's innermost layers. And sometimes we will come to know clearly after the symptoms appear on the skin. Full stop. If the disease has come to the skin level, means the vital force could successfully, skin means the vital force could successfully drive out the disease, drive out the disease to the outermost layer. This point you must understand properly. Many times skin appears, problem appears on the skin. It has not come from external source. The skin problem is not because of the external reasons or causes, except some accident or some connection with the poisonous things, something like that, or burn injuries or cut injuries because of the external things. Many times all the chronic diseases, they have their manifestation on the skin. That is only because the God is so great that he drives the disease out to see that the man continues to stay in that house for a longer period. This I told earlier, again I am repeating. We take a house on rent. If we are good, if we take a house on rent and if we are good, the owner will ask us to continue. Last point again I am repeating. All the chronic diseases have their manifestations upon the innermost layer and then comes to the skin. So the disease has traveled from innermost to the outermost. When the disease has come from within, medicine also should work from within. Cure also should work from within. That is the reason we will not prescribe any ointments for skin problem. Maximum I recommend neem oil or coconut oil for the patient who is having lot of skin problems. So when we give a medicine for suppression of the skin disease by applying ointment, disease safely goes inside. And again it tries to come out. That is the patient's common report. Sir, as long as I was using that ointment, my skin is okay, sir. I stopped thinking that it is cured. Again it is coming out. When you apply ointment means it has not gone anywhere. It has gone inside. And when the ointment's effect is reduced, then again it will appear on the skin. Without any internal problem, generally skin problem will not be there. There is no problem inside, there is no problem outside. Okay? Right. When the skin comes, that means it has come from within only, cure also from within, and medicine should not be given based on the skin problem. We should give the medicine to the most person who is the person who is leading this. If the person is all right, skin will become all right. Never run after the skin problem, finding out a medicine for skin. This is important. Never run after the skin problem. Okay. Next point. If any skin problem comes, from within, the physician should understand that it is resultant of some chronic disease cause present in the patient, and Dr. Hahnemann calls this disease cause as a miasm, MIAS. Understand that it is a resultant of. That means there is a disease inside already, cause is there, that cause wants to send the disease out, and the physician should understand if a person comes with some skin problem, it is also, one more point I want to tell you, it is also due to the pollution. A person working in some chemical factory, he will be in touch with so many chemicals. He may get a disease on the skin because of his contact with the chemicals. But remember, in this case also, there are so many people working in the same factory. 100% people are not getting this. The immunity levels of other patients, other persons working in the same factory are much better than the person who got the skin problem. Might be he is in touch with chemicals, but all are not getting. Again, here the theory of immunity, which was coined during the COVID time, we understand. So here clearly is telling that there is a disease called already present in the body, which we call it as miasm. The disease cause manifests itself or drives the disease out to the circumference or the skin, hair, nails, etc. And the disease appears there, which is very, very safe. If the skin problem is suppressed, it is possible that some internal organ will get affected and the patient may become a chronic, incurable patient. This we must understand clearly. And any educated patient comes, you have to tell them about the science of homeopathy. If somebody comes to me after giving medicine, my medicine is there, somebody comes and says, "Sir, I got skin problem," I will immediately ask, "Where are the sweets?" What for, sir? You got the skin problem. You got skin problem means the medicine has worked in proper direction, it is sent out. And skin problem may be itch, maybe a scare, maybe another this one, anything, extra growth, all these are called because of the disease cause inside, the problems come. And when we select the right medicine, automatically the tumors will disappear, skin will become normal, hair fall will stop, and patient improves in all the things. Maybe that there is no skin problem, patient is not well inside, no problem. Every patient comes to us does not have skin problem. Remember, it is not compulsory that the person should have skin problem or person will get skin problem after homeopathy. All the persons will not get. Disease might go out through some other source. It may go through urine, it may go through sweat, it may go through, it may go out with any other course, any other way. Don't imagine that everybody should have skin problem. And don't tell the patient that unless you get a skin problem, you don't talk to me. It is not correct. So there are medicines which will drive the disease out. Skin problem may be also due to the excessive usage of allopathic medicines. Is due to the unhygienic conditions where the person lives. It is due to the too much pollution. You take Delhi, Bangalore, Hyderabad, how much air pollution is there? How much water pollution is there? All these are the causes. And also, according to homeopathy, the main cause being is chronic disease cause which was present in the person and then slowly it comes out. This is the understanding. You must have a clear idea about this so that if a person comes with skin problem also, you can understand and make him understand the correct position of the homeopathic medicines. Next point. One must take care of the patient. One must take care of the patient with the skin complaint and explain him about the homeopathy as the vital force could drive the disease up to the skin and the he may need some support from external homeopathic medicine, not external, from homeopathic medicine, which can help to further, drive out the disease completely. This is the important point. So up to skin, the vital force could drive it out, send it out. But there on the skin, it requires lot of energy. The vital force needs lot of energy to send it out. There it needs some support, like homeopathy medicine, which will drive out the disease clearly. This has been my experience. Whenever skin complaint comes, when you give a right medicine, automatically patient gets cured. Nothing to worry about the skin problem. Okay. Next point. The patients generally worry about the skin problems and they request us to cure the skin complaint first. Because it looks ugly. And this I can tell my many number of experiences are there in this, particularly the girls between the age group of some 15 to 25 something. They come and ask us, sir, I'm getting lot of acne, I'm getting pimples, I'm getting lot of skin problems. Even this is possible with males also. At the age of some 12 and 25, there will be lot of hormonal. A girl is going to become a mother from the puberty. To make a girl as a mother, how many corrections are to be made within a girl? How many hormones are to be released within the person? So much change in the physical appearance, so much change in the mental attitude. All these things happen. That is why it is called teenage. From 13 to 19, it's called teenage. Lot of changes occur in the person. As a result of all these things, skin complaints may come. Even acne on the face, which looks ugly, some scar will remain. The patient feels, first, sir, please kindly cure my skin problem. If you go deep into the details of that girl, you ask her whether your menstrual cycle is regular. No, sir, don't worry about menstrual cycle. First, I want to get my skin cured. There it requires lot of patience of the homeopathy doctor to explain them that internal menses cycle is more important than your hair fall or than the skin problem. The internal is all right, everything will be all right. This you have to educate the patient, particularly I told you teenage girls and their parents. You have to tell them that she is in the right direction. If you don't treat her menstrual cycle properly at that young age, she may get more troubles once she grows up, including the infertility. There are cases now, there are a lot of infertility cases are coming. Earlier, there were no so many cases. They are because of the suppression of hormones, change in the hormone levels. And that happened because of the chemicals, usage of chemicals. We use so many chemicals as cosmetics. These are all dangerous to the body. In olden days, they used to use turmeric powder, sandal powder as the cosmetics. Now we don't find any turmeric or sandal. We find all chemicals. That too, the youth are getting these chemicals from other countries. They are purchasing very costly medicines. They want the skin to be shining. They want skin to do very good. But in case of boys, no problem because 75% of the face is covered with beard. There is no problem. The problem with girls, when the situation is so bad, when they start using these chemicals, immediate effect of that is the change in the menstrual cycle. Either it is delayed or it is early. I know recently I received one case, menses for every 15 days. Very bad. Or no menses for 3 months. Equally bad. Both you should understand. When proper homeopathy medicine is selected, first thing what the body will do, the vital force will do is make the cycle regular. If there is stomach pain during menstrual period, which we call as dysmenorrhea, that is a technical term, stomach pain during menses, back pain during menses. First, that will be reduced. Cycle is regularized. And skin is the last one to worry about. And we have to educate the patient accordingly. Then only we'll be able to give right medicine. So, this is the important point we must understand in selection of the right remedy. And when a right remedy is selected, the cure comes from within to the outwards. That is today's class. We'll continue about this and we will go for one medicine next Wednesday class. And classes will be again on Wednesday, Thursday, and Friday. So, my request to the members, please log in before 7:25. If you come at 8 o'clock, 8:10 or 8:20, we are very punctual in maintaining timings. Yesterday even, the class was concluded at 8:30 exactly, even after spending the time for question answer session. That is why we are giving 10 minutes time for the question answer session. And I observe that question answers, only same set of people are asking. When there are 160 members are there in the class, what other members are doing? Are they listening or not? Are they able to understand or not? The questions to be asked by all the persons, not the same set of people. Daily I listen to same set of people. If you have a fear of asking questions, you please make yourself ready for that, and I am here to answer. So we conclude here, and Now the forum is open for question answers. Satyanarayana.
Yes, sir. Anubharti, madam.
No, sir. Just a mistake.
Sorry.
Just a mistake by touch.
Okay, fine. Okay. Little bright minds.
Sir, namaste. This is Vani from Mysore. Just wanted to know, one point is there regarding the miasms. So miasm, is it that always due to the any inner hidden problems coming out of the skin, or is there any other thing which we can name it as a miasm?
We can inherit also. Miasms can be inherited from our elders. Miasms you will get from the bad habits because of the other reasons. But miasms are generally by birth. We will have them. Okay.
No, like is it like related to skin only, like having
No,
any
need
or
not,
any other things? Need not be.
any organ can be affected.
Okay. Thank you, sir.
Padma Priya.
Yes.
Good evening, sir.
Good evening.
Sir, I want to know about the psoriasis and dark circles around the eyes, sir.
Dark circles around the eyes are due to the anemia. And the bloodlessness is there. When we don't have sufficient blood, dark circles do appear. And psoriasis is one of the skin problems because of the internal disease cause. That can be cured by giving a proper medicine from within outwards. Psoriasis also is curable unless it has become very chronic for years together. Okay, it can be cured.
Okay, sir. One more question. Is psoriasis related to lice in the head, sir, and hair fall, sir?
All are related only. Everything is connected to the person.
Okay.
Whose hair is that? They will come and ask me, sir, hand pain, leg pain, sir, have you given medicine for my leg pain? Then I will ask, whose leg is that? My leg, my hand, my hair. So only they are all connected with the person. And when we are treating the person as a whole, automatically these will be cured, is it not?
Okay, sir.
All are connected to the person. Next.
Okay.
Please switch off. Unmute.
Thank you.
Munishwar. Munishwar Billa.
Sir,
Yes, sir.
Sir, good evening, sir. We are from Hyderabad, sir.
Padma,
Sir,
switch off your video and audio. Padma Priya. Audio and video, switch off. And next.
Sir,
Yes.
Munishwar, sir.
What's your
Sir,
name?
Sheridan Munishwar, sir, Hyderabad నుండి.
Yes.
సార్ ఈ డార్క్ అంటే బ్లాకిష్ వస్తుంటుంది కదా సార్, శరీరం మీద అక్కడక్కడ డార్క్నెస్ వస్తుంది అని అంటే మనకు ఇంటర్నల్ ఆర్గాన్స్ ఎఫెక్ట్ ఏం లేకుండా అంటే అది ఎనర్జీ లెవెల్ ఉండి బయటికి శరీరం మీద కనిపిస్తుందా సార్ డిసీజ్, లేకపోతే ఏదైనా డిసీజ్ ఇంటర్నల్ ఆర్గాన్ లో ఉండి అది స్కిన్ మీద ఏర్పడుతుందా?
It is possible in any way. The disease may be present in all the organs simultaneously. May be having skin problem, may be having same time, may be having liver problem, kidney problem. It will exist, coexist all the symptoms. That is why symptoms are important to us. And the darkness of the skin is one of the symptoms. That is not a disease. We don't have any diseases. We have only sick people.
అంటే మనకు ఇప్పుడు మనం ఇప్పుడు ఒక డిస్కషన్ చేసినాం కదా సార్, పొల్యూషన్ తోటి కూడా బ్లాకిష్ వస్తుంది అని చెప్పేసి, ఆ పొల్యూషన్ ఎఫెక్ట్ కూడా శరీరం మీద ఉండి బాడీలో బాగా ఎనర్జీ లెవెల్ ఉండి ఆ స్కిన్ మీద వస్తుందా? అట్లా వచ్చేందుకు అవకాశం?
బాడీలో ఎనర్జీ లెవెల్ కి దీనికి సంబంధం లేదు
సార్.
The body's immunity power ఏదైతే ఉందో, when it comes down, the immunity power comes down. The disease or the symptom may appear anywhere, mostly on skin, because pollution is directly skin is exposed. That is the reason.
అటువంటిప్పుడు మనం ఇంటర్నల్ గా క్లీనింగ్ చేయాలి సార్.
We have to give medicine only to the person.
సార్
always to the person, but not to the
Sure.
disease. Right.
Yes, sir. Thank you,
Next.
sir. Thank you.
Roshan Bhatta. Roshan Bhatta.
Hello, sir. Namaste.
Yeah.
Sir, I wanted to ask if, this skin
It
problem,
it can be on all over the body also. Mainly
any part, right?
any part.
Okay.
Any
So
part.
how do we
Any-
differentiate? The skin problem, are they like a miasma or something?
We are not differentiating, or we are not coming to a conclusion based on we select one of the medicine based on totality of symptoms. In the totality, this is one set.
So for those skin problem, we shouldn't take any medicine, even a small one.
That is one of the symptoms. We select a medicine for total symptoms. So this symptom is also taken care of.
So this is like a body being cured, or this is itself a part.
This is like person being cured. This is like person being cured. And once the person is all right, his vitality is all right, he is able to cure anything on the skin or any organ or anything.
So
We don't interfere with the person.
another
only
question,
give
sir.
Person and he will cure himself. We don't interfere with any disease.
Another question. There one scenario where I see a person doing some hallucination type of work. Like, what could that be related to?
Mind symptom. That is the mind symptom, hallucinations.
It could be some mental problem or something like overwork.
It is mental disorder. Mental disorder, yes, sir.
Thank you, sir.
Namaskar.
Valli
Next.
Funny 61. Valli Funny 61.
Namaste, sir.
Namaste.
Today's class centered to circumference. It is the first point. What is meant by center? Center means is it mind or anything, sir?
It is the center is the one which is governing the entire body.
Okay, okay.
There is an internal force, internal vital power, which is making us to move, which animates the material body, which is running everything, which goes out, we call this as a dead body. That pranic force.
Okay. One more doubt, sir. What are meant by vital organs? Please, will you explain in detail? Organs.
Vital organs are important organs without which the patient dies. Brain, heart, kidneys, lungs, liver, these are the vital organs.
Okay. So, when I have given to medicine to some patients, immediately they asked me it will be cured or not. I said it takes some 1 month or 15 days or 2 months. But they asked immediately it will be cured. What can we say, sir, to patients?
We can tell them, please go to allopathy.
Okay, okay.
This will work as per the system. So if you don't have patients, you need not be with us.
Okay, thank you, sir.
Right.
Priyanka Bhatt.
నమస్కారం సార్.
Namaste.
సార్ ఈ స్కిన్ ప్రాబ్లమ్స్ లో పులిపిర్లు అంటారు కదా, అవి కూడా యాడ్ అవుతాయా?
Everything.
ఓకే, అది మనకి అన్నోయింగ్లీ అంటే ఇదంతా కాన్సెప్ట్ తెలియక ముందు కట్ చేయించుకున్నారు అనుకోండి, అది ఏమన్నా ఎఫెక్ట్ ఇస్తుందా?
It will come again.
ఇట్ విల్ కమ్ అగైన్. ఓకే సార్, థ్యాంక్ యూ సార్.
Right. Next.
ఆచార్యులు.
ఆచార్యులు సార్. నమస్తే సార్.
Namaste.
సార్ ఆచార్యులు ఫ్రమ్ హైదరాబాద్.
Yes, sir.
సార్ ఈ మధ్యన అంటే ఈ కాంబినేషన్స్ అన్నారు కదా సార్, అంటే మదర్ టించరు 3x లో
Yes.
వాటి మీద మీరు అడ్వైజ్ చేయండి సార్.
Combinations are allowed in biochemic system. Homeopathy combinations are not permitted as per the rule. It is only because of the Kali Prabhava. According to my opinion, combinations are not good. Next.
ఓకే సార్, థ్యాంక్ యూ.
Anita Kadimi.
First.
Anita Kadimi.
నమస్తే సార్. సార్ మీ క్లాస్ చాలా బాగుంది. నా
Thank
డౌట్
you.
ఏంటంటే సార్, మా పిల్లలిద్దరికి కాకినాడ వచ్చిన తర్వాత కాళ్ళలో ఆనెలు రావడం మొదలుపెట్టినవి. సో ఐ యామ్ టు ఫైండ్ ద రూట్ కాజ్ ఎందువల్ల వస్తున్నాయి అని. ప్లస్ బాబు చాలా బాగా ఎక్స్టెన్సివ్ గా ఆడతాడండి, రోజు 1 hour.
Individual cases we cannot discuss here. You contact the local doctor. You understand the concept. That is important. Here we don't have time to discuss individual cases. Okay.
Sandhya Rani. Sandhya Rani.
Yeah, it's Sudha Rani, sir, from Karnool, sir.
Yes.
Sir, one point we discussed, like vital force needed a lot of effort and energy to drive out the disease from out the skin. I mean,
Yes. Yes.
on the skin nunchi podaniki. But if at all it is in the mind, then does it take less effort?
Yes.
And in that case, మనం మైండ్ కి అయితే పొటెన్సీ ఎక్కువ ఇస్తారు కదా సార్, ఐడియల్ గా. ఐ మీన్
Yes.
ఇన్ దట్ అప్పుడు మైండ్ లో ఉన్నప్పుడే మనం ఎక్కువ పవర్ ఇస్తున్నామంటే
మైండ్ తో పాటు స్కిన్ మీద కూడా ఉంటే
ఉంటుంది.
మీడియం పొటెన్సీస్ యూజ్ చేస్తాం అని చెప్పాను నేను.
yes సార్, అదే. yes yes, got it. Yeah, got it.
Read the whole.
Ravi N.
Sir, Ravi from Hyderabad.
Yes.
Sir, we understood that coffee consumption is not good while using homeopathy.
Yes.
If tea also has the same impact, then what is the safe hot beverage that we can consume,
but
sir?
less dangerous than coffee. Tea is less dangerous. But tea is also a medicine in homeopathy by name Thea, THEA.
Then what is the safe hot beverage we can consume, sir, when we feel like some relaxing
Milk with something, ragi malt, badam powder, natural substances are there. Many natural substances. You can take that. Barley water.
And this green tea and hibiscus tea, these are also not advisable, sir?
They are also chemicals.
Okay, got it, sir. Thank you so much, sir.
Right.
Sairam Divyadala.
నమస్కారం అండి. ఇప్పుడు అంటే స్కిన్ మీదకి వచ్చింది అంటే లోపల ప్రాబ్లం ఉంటే స్కిన్ మీద కనిపిస్తుంది అంటున్నారు. మరి అలాంటప్పుడు వైటల్ ఆర్గాన్స్ అంటూ డిఫరెంట్ చాలా ఉన్నాయి. సో ఏ ఆర్గాన్ లో ప్రాబ్లం ఉందో మనకి స్కిన్ మీద ప్రకారం తెలుస్తుందా, అంటే అనుభవం ప్రకారంగానన్నా తెలిసిపోతుందా?
అసలు మనకి ఏ ఆర్గాన్ లో ప్రాబ్లం ఉందని మనం ఆలోచించాల్సిన అవసరం లేదు. ఏ ఆర్గాన్ లో ప్రాబ్లం ఉంటే ఆర్గాన్ సంబంధించిన సిమ్టమ్స్ వస్తాయి. వాడు స్టమక్ పెయిన్ అని చెప్పాడు, లేకపోతే చెస్ట్ పెయిన్ అని చెప్పాడు అంటే చెస్ట్ సంబంధించిన ఆర్గాన్ ఉంది. లోపల ఏమీ లేవు, ఓన్లీ స్కిన్ మీద ఉందంటే లోపల ఆర్గాన్ సేఫ్ గా ఉన్నట్లు లెక్క. యు నీడ్ నాట్ వరీ.
స్కిన్ మీద ఇచ్చింగ్, స్కిన్ మీద బర్నింగ్ అంటే అది ఓన్లీ స్కిన్ మీద ఉన్నట్టే, లోపల ఉన్నట్టు కాదని అర్థమా?
లోపల లేదు, ఉంటే ఆ సిమ్టమ్ కనిపిస్తుంది. అది ఉంటే కనిపిస్తుంది.
కొంతమందికి తెలియకుండా అంటే స్కిన్ మీద ఉన్న ఎఫెక్ట్ ఎంత ఎక్కువ ఉంటుందంటే కొంతమందికి మంట గాని, దురద గాని, నిద్రపోవడం గాని ఇలాంటివి ఉంటాయి కదా. దాన్ని బట్టి లోపల ఆర్గాన్స్ మీద వాళ్ళు కాన్సన్ట్రేట్ చేసే అవకాశం కూడా ఉండదు. లోపల ఆర్గాన్స్ డ్యామేజ్ అయిపోయి కూడా ఉండొచ్చు కదా.
Then we have to take the totality of symptoms, the feelings, sensations, like behavior symptoms. అవన్నీ తీసుకొని మందు సెలెక్ట్ చేస్తాం.
Thank you.
Right.
Ravi N.
Sir, I already asked. Maybe I had to
switch off. Already
yes,
asked.
Sir.
Unmute.
Shravani.
Mute, not unmute. Yes.
Good evening, sir.
Yes. No formality.
Sir, ఇప్పుడు ఇన్ఫర్టిలిటీ గురించి మీరు ఇప్పుడు చెప్పారు కదా. నెక్స్ట్ థర్స్డే క్లాస్ లో ఇది కంటిన్యూ అవుతుందా లేకపోతే ఇది అవుతుంది? ఓకే, థ్యాంక్ యూ. అదే
నెక్స్ట్ ఏంటమ్మా
క్లాస్ లో కంటిన్యూ, నెక్స్ట్ థర్స్డే క్లాస్ లో కంటిన్యూ అవుతుందా లేకపోతే రేపు చెప్పే క్లాస్ లో కంటిన్యూ చేస్తారా అనేది క్లారిటీ లేదు నాకు.
So Wednesday I will continue about the cure. Okay. Next Wednesday class.
Okay, master.
Right. Next.
సార్ నమస్తే సార్.
Yes.
పొరపాటున టాన్సిలైటిస్ అని టాన్సిలెక్టమీ చేసిన వాళ్ళకి
Hmm.
ఒకవేళ ఇప్పుడు లివర్ ఏదో ఒక పార్ట్ తీస్తే రీజనరేట్ అవుతుంది. ఆ విధంగా టాన్సిల్స్ మళ్ళీ రీజనరేట్ అవుతాయా సార్ ఒకసారి
కావు.
రిమూవ్ చేసిన తర్వాత?
కావు.
అవునా సార్? ఓకే సార్, థ్యాంక్ యూ.
Okay.
అలాగే.
బిందు ప్రియ.
నమస్తే సార్, నా పేరు బిందుప్రియ ఫ్రమ్ బెంగళూరు సార్.
Okay.
కెలియాడ్ కూడా స్కిన్ ప్రాబ్లమ్ ఏనా సార్? ఇంటర్నల్ ఏదైనా ప్రాబ్లం వల్ల వస్తుందా?
ఏంటది?
కిలియాడ్ సార్, కిలియాడ్ అంటారు కదా.
Keloids.
కెలాయిడ్.
Yeah, that is also internal problem.
ఇంటర్నల్ ప్రాబ్లమ్ సార్. ఓకే,
Yes.
థ్యాంక్ యూ.
Mind. Right.
ప్రవీణ్. Okay. భార్గవి.
Namaste sir, I'm Bhargavi from Hyderabad.
Yes.
So if you have a skin issue, could it be related to a problem in the blood, sir?
It is connected to everything. It is connected to person.
Okay.
You have to take the person as a unit
Okay, sir. Thank you.
and select the medicine.
Okay, sir.
Totally. Next.
I think
Sir,
Yes.
hello sir.
Praveen.
Praveen sir, yes. Yeah, sir. Actually, my question is, this when we see that when we say that it's we need to identify the medicine on totality basis. So this
Sir, your voice is
totality-
not clear, sir. Sir, your voice is not clear.
You tell me.
I'll
Yes.
change.
We have to
Can you
select
hear
the
me?
medicine and totality. Correct.
Yeah, and totality we need to. So this totality, the characters of the personality can change over a period of time, sir. Like
Yes,
say
can
when
change.
so how
Yes.
do we shortlist the medicine, sir? In that case, let's say we have chosen the medicine now, looking at the constitution.
It comes by experience and seeing so many patients.
Okay, sir.
Very, very difficult to understand the person.
Mm-hmm.
So
Okay.
many diverse cases are coming.
Mm-hmm.
Wife first misunderstands the husband, husband misunderstands the wife. Those staying together for 20 years, they cannot understand. Same is the case with the homeopathy also. So understanding the personalities is a big art. Okay, it will come by experience.
So second question, sir. So this when we choose a constitutional medicine, sir.
Yes.
So should we choose the constitutional medicine for all the cases, like whenever a patient comes in? First,
Yes.
we need to choose the constitutional medicine and then the additional medicines, like
Yes. Yes.
So
I will
how
tell
do we?
you. I
how
will,
do
I
we
will tell you. I will tell you in next future classes.
Okay, sir. Okay, sir. Thank you so much.
కోరాడ శ్రీలక్ష్మి.
సార్ నమస్తే సార్.
Yes.
సార్ ఇప్పుడు ప్యూబర్టీ స్టార్ట్ అయిన తర్వాత అమ్మాయిలో ఐస్ కింద డార్క్నెస్, అలాగే మెడ చుట్టూ డార్క్నెస్, అండర్ ఆర్మ్స్ లో చాలా డార్క్నెస్ వస్తుంది సార్. అది డాక్టర్స్ కి చూపిస్తే ఎకంథ్రోసిస్ నిగ్రికన్స్ అని అంటున్నారు సార్. దానికి హోమియోలో ట్రీట్మెంట్ ఉంటుంది.
హోమియోలో ట్రీట్మెంట్ ఉండేది పర్సన్ కి. If person is available, treatment is available. Allopathy don't compare. Here we treat the person. Person is available, treatment is available.
ఓకే సార్, థ్యాంక్ యూ సార్.
ఇది 6 months అయిన తర్వాత కూడా ఈ ప్రశ్న మీరు వేస్తారు. నేను ఎంతో ఓర్పుతో సమాధానం చెప్తాను. నా ఓర్పు తగ్గదు. ఓకే ఓకే, Satyanarayana, close.
I have over, sir. Thank you, sir.
Thank you very much. We'll meet again on Wednesday.
Thank you.